So welcome at the EACTS 26th annual meeting in Barcelona, and I'm very happy to have Jeff Rich here, the president of the Society of Thoracic Surgeons from the United States. And Jeff, welcome in Barcelona. We're very honored to have you here, and we're already looking forward to the future, and we're also looking forward to the next STS meeting. Where will it exactly be?
Well, first of all, I'm honored to be here as well, and thank you for inviting me. It will be in an exciting new place in Los Angeles.
Great. And of course, the scientific program, we're looking forward to that as well. Especially, I think also, what always attracts a lot of people is the TechCon on the Saturday. Can you tell us a little bit what you have in mind for TechCon this year?
I think very much what you had in mind here. TechCon will be both Saturday and Sunday. It's going to talk about really didactic teaching from experts in the field about the different exciting new technologies that are out there.
Of course, TAVI is one of the most innovative techniques now in cardiovascular medicine, you could say. And is there room for TAVI as well at the meeting?
Yes, there'll be room not only at TechCon, but during the general sessions. We have an entire afternoon session on TAVR directed towards all the late-breaking trials and all the new science that is revolving around it. We also have a special session with the ACC, joint collaborative session, where we will be talking about TAVR, and we'll be talking about the heart team and the approaching patients as a heart team, not only for that, but for coronary revascularization. And we're going to bring in the federal agency to talk about their perspective on TAVR and the position the U.S. government has on TAVR and an advancing, exciting new technology.
Well, that's great. So you actually cover all the topics around TAVI and hopefully get a good discussion there.
Yes, and there will be an entire session in the afternoon on Monday and another one on Tuesday as well.
Great. Well, that sounds very good. So one of the highlights is always all invited guests at the meeting, so to bring a new light on certain aspects in our field. Do you have special guests in mind that you are inviting at the STS meeting this year?
Yeah, two very special guests, both of which I worked with in Washington, and both are very prominent, not only in healthcare, but in healthcare research. The first would be Mark McClellan. He ran CMS and ran the FDA. He then, at CMS, did a lot of innovative thinking for healthcare reform. I worked with him while I was there, and then subsequent to that, much of what we're seeing in our Affordable Care Act came out of the work that he did and that we did together. So he, an enormous resource and a very highly respected individual in healthcare reform in the United States. The second would be Carolyn Clancy. She's the director of the American the Agency for Healthcare Research and Quality. She's going to be talking about comparative effectiveness research as it impacts clinical cardiac surgery and cardiology, and her views on that. She's very intelligent and an articulate speaker, so she'll have a lot of great ideas to bring forward to us.
Great, because at the moment reimbursement for TAVI is, of course, it is reimbursed TAVI procedures, but still it's not so favorable for a clinic to do a lot of procedures. Is that correct?
We're still working on the exact reimbursement model for it. There's a model out there, but the pricing of that is going through the regulatory cycle, so that it's being priced through the different payment systems at CMS, and so eventually we'll figure it out. It's due probably to come out towards the end of the year.
Right, and so that will be probably one of the topics to discuss.
Yes.
Yeah, great. So of course, we have lots of topics that are clinically relevant for us, and some are more the basic science topics, and I guess you will also cover these ones as well at the meeting?
Yes, so we try and also take basic science and translate that into practice. So we want the practicing surgeon to come there, learn some basic science, but bring it back and translate it into his or her clinical practice right away. And that's the same approach we've taken for the STS, or the STS University, where you can get hands-on techniques and bring it back to your practice right away.
Great. Well, we're looking forward to that. Is there one thing that you want to say to the members from CTSNet why we should go there to Los Angeles? One of the most important things.
Well, besides all the clinical relevance that the meeting will have for the practicing and the academic surgeon, it will be a very nice venue, very exciting activities going on that are related to Los Angeles. And so it would be a wonderful time to all get together. And I think more so, and I know you feel this and we feel this in the United States and in Asia, we want to bring the world surgeons together, the world cardiac surgeons together, and so we're all looking for ways to collaborate more heavily.
Oh, perfect. So I'm looking very much forward to the meeting in Los Angeles. It will be, I guess, a great meeting and a great venue, as you have said. So looking forward to come to Los Angeles and see you there.
All right.
Thank you very much, Jeff, for this.
Thank you.